folks, it's Blake. We're here with our ring removal specialist here at Ring Rescue, Daryl. How you doing today, Daryl?
Great, Blake. Happy to be back again.
Well, we are extremely happy to have you, my friend. So we're here to talk about manipulation techniques when it comes to stuck rings and the importance of it. So Daryl, what are some different manipulation techniques that you use when getting a ring off in stuck ring scenarios?
That's a great question, and we always say that the device plus you equals success. So the key there is you, right? We know the device will strengthen the finger 100% of the time, so now we actually have to use our techniques to take that off. So the first thing I always recommend, in your kit, you have the Ring Rescue Supply gloves. We always recommend that you actually use these gloves. And the reason why we want to use these gloves is that you need to have the traction on the actual smooth bands. Once you apply the lubricant, you need to have traction to be able to manipulate that ring. Second, I do the manipulation, the patient or the customer does not, okay? So I can actually apply those techniques properly. That person does not necessarily understand what we want them to do, so I like to do the removal. I don't have them remove their own ring, okay? So first thing, the actual lubricant. Spray the lubricant onto the actual finger underneath the ring. Rotate the ring so that you get the lubricant underneath so that the ring will move freely. The first method that we want to actually talk about is called the corkscrew. And think of it as just that. What does a corkscrew is? It's a circular direction. So rotate this. You can go back and forth, or you can continue to do one direction as you slide that off the finger. Sometimes you actually do corkscrew and you add what we call the rocker. And the rocker is when you actually go back and forth, and I call it walking down the finger, is essentially what you're trying to do. And this is the slow and steady part. Remember, we can displace the fluid, but you can't shrink or displace skin. So you actually have to allow that skin to be able to pass under the ring. So what you actually want to do is be nice and slow and steady. And that leads us to the third one, which is the counter traction. So to apply counter traction, sometimes you will have to just wipe off a little bit of the lube at the base of the finger. Pull back on the skin as you do the combination of the corkscrew and the rocker, and what you're doing is you're just pulling or helping that skin come underneath the ring. Then lastly, if you have a little bit of a hang up there, bend that finger down about 30 degrees, and what that actually is going to do is it's going to elongate or stretch that tissue instead of having that bunch up. It's going to stretch that tissue, and then as you do a combination of both the corkscrew, a little bit of the rocker, and some counter traction, it's going to allow you to pass over that thickest part of the finger, which is going to be over the knuckle, by having that skin stretched, and then it's just going to pop off for you.
Well, and there you have it, folks. It's Ring Rescue Compression Device plus you equals success. Thanks for the tips, Daryl. And until next time, it's Blake, it's Daryl. See you later.